Hello and welcome to Table for Two. This is a special bonus episode of the Reason Roundtable where we answer even more of your questions. And I am your temporary host, Katherine Mangu-Ward. I am joined today by the beautiful, elegant, talented Robby Soave.
Stop. Nice to be with you, Katherine.
Happy midweek podcast, Robby.
Yes, indeed.
We are going to answer a pretty serious policy-oriented question from a listener who writes in, good evening. Huge Reason Roundtable fan, could you please talk on the show about Katherine's recent boob job? And more importantly, how libertarians view cosmetic surgery covered by insurance in relation to a vastly controversial healthcare system, often funded by our taxpayer dollars.
I love how workplace appropriate this question is. Always one to discuss with your boss.
Yes.
I also, just to get all the disclaimers out of the way, I had to discuss, obviously, Sydney Sweeney's boobs with Matt Welch and Camille and Michael Moynihan on the Fifth Column at length. If you're following any updates in my personal life, you know me and this subject have diverged wildly. So it's pretty funny. With all that said, go ahead.
You've become Reason's boobs correspondent at the most inopportune time in your life.
Yeah.
So first of all, I did not get a boob job. I don't exactly know what the impetus of this question is. Like it wasn't like linked to a specific episode. So I just want to say thank you so much. Thank you. Truly, I am complimented. And I'll just kick it off by saying I think that the existence of plastic surgery and the way that the plastic surgery market works is a really interesting thing for libertarians, actually, because it's a part of the healthcare system that is the closest that you can get in many ways to a genuinely private system. You can see this also with LASIK, like with laser eye surgery. And we also used to say this about dentistry, like that's come more into a public style system over the years. But one thing you see is like when people just pay out of pocket for medical services, all these things that people hate about the system do tend to go away. So, Robby, are libertarians pro plastic surgery?
Yeah, absolutely. For all the reasons you just mentioned. I remember reading something in Reason about, the dental industry and how innovations in like virtual dental services being consultations, provisions, which were utterly and completely opposed by the dentist industry. In fact, I think I read frequently that is a lot of the stuff the dentist does for you even medically necessary, and there's all sorts of cartel capture-like behavior there that's so prevalent in our entire medical system because nobody understands what they're paying for because of our unique system of subsidies and insurance, and you go to the doctor and you don't know, unlike every other thing in your life where you go to the grocery store and you buy something you want and you know what it costs. What if you went and bought things at the grocery store and then weeks later you got a bill for what you bought that didn't correspond to anything you purchased and that you had to haggle with some bureaucrat about it? It makes no sense. It's bad. This kind of market is actually the direction we would want to take the whole healthcare provision industry so that prices and services match each other in some very basic way. It would be great. That's the legal regime. Aesthetically, I don't know how forward I am. Sometimes people be going overboard on this stuff with the lady faces. Sometimes it's too much.
I mean, I think this is also a classic example of you can only tell the plastic surgery happened if it was bad.
Yeah,
so our sample is bad. So actually, maybe, never mind. I'm angry at this question asker who thinks I got a bad, obvious boob job. So, but I actually think the way the question was asked is also very telling. Like the question was, cosmetic surgery covered by insurance in relation to the healthcare system, which is often funded by taxpayer dollars. And that kind of line of reasoning, I think, so often takes us to a two wrongs make a right type of logic. If taxpayers are paying for it, then it is the proper role of the state, maybe of RFK Jr., to decide what things should and should not be legal. And I think it's so important to separate what should be legal and what should taxpayers pay for. Our healthcare system is fantastically bad at that. No one can see what things taxpayers are paying for, what things taxpayers are footing the bill for, and more importantly, where the prices are being set and what part of the system. Because of course we do have a massive number of people who are on Medicare and Medicaid, which function not exactly but sort of like the public systems in other countries. Let's talk a little bit about kind of the insurance market generally, right? Because my other instinct in response to this question is like, why in the world would insurance ever cover plastic surgery? Like, why would that be a thing that would exist at all in a market? It seems like health insurance should be like other kinds of insurance and help you prepare for catastrophes. Am I wrong, Robby? She asked in a Joan Stossel voice.
Well, you could have all kinds of markets for insurance, right? I mean, if someone thinks there's some money to be made in offering this kinds of insurance and people value it, they would buy it, and as they are free to do that, right? Any exchange of compensation, I will in this event give you this money, and that event comes to transpire, and then if I don't give you the money, you should be able to sue me if we've made some kind of contract. The danger comes in with when it's mandated based on just what you were saying. I go through this all the time. Like, you very quickly get to a place where could we prohibit smoking? Because people who smoke their whole lives have worse health outcomes. They cost the system more money. And our socialized system, you don't make them pay more for their health care. Everybody gets paid whatever they need in a truly socialized system. But then the people running the system have a lot of have genuine incentive to put limitations on whether you can smoke, and then you can quickly get to a dystopia place where we all have to be jogging in place all the time to lower the healthcare burden we are all giving collectively. We want to get away from that kind of decision making wherever possible, but as we're in the interim in a place where yes, the system is paid for, I always try to. I think even though you could make some argument whereby like, well, if I have to pay for it, then shouldn't there be some more government constraints on the system? I think we will argue ourselves into anti-libertarianism if we do that. So we should always start with, well, even if they're paying for the whole thing or making the thing be socially paid for or socialized, we should still not try to put behavioral limitations, because that's a slippery slope, like a very literal slippery slope to where we're all going to have to be on slippery slopes all the time to improve our average health outcomes.
We have to climb actually up the slippery slope continuously.
They're making the slope less slippery in order to burn calories.
We'll have to push a boulder up the slippery slope eternally as punishment for our misbehaviors.
I mean, private insurance markets, though, that like car insurance is notoriously pretty bad, right? And now you're required to have it. So maybe that's, again, not a market failure, but a government failure.
Yeah, I mean, I think this is, again, if you're kind of looking around for examples of systems that are not touched by the state, the insurance market and reinsurance markets are so heavily regulated and so complicated and so bureaucratically, there's so much bureaucratic capture and rent seeking that it's really hard to see that and to sort of point to something and say this is what it would look like. I do think this is something that Mark Andreessen said when I interviewed him a while back, that the only truly free areas in markets are things that are frivolous. And I think, probably like the insurance market for like fine art or something. I don't know anything about it, but I would guess that might actually give us more of a hint about what truly free insurance markets might look like.
I technically have, this is going to be my second time, I think, talking about my scooter situation. Did I bring this up last time I was on the Reason Roundtable? I didn't.
The people demand to know about your scooter habits.
My scooter was stolen. In fact, the whole national crime, DC police federal takeover was a response to this. Donald Trump intervening very personally, mere moments after finding out that my scooter had been stolen in the streets of DC, obviously.
He's a public servant.
It's a lease, and I pay for theft protection for it, a kind of insurance. And so because that's the situation, they are mailing me a new one, and I think it's waiting for me at my apartment as we speak. Took a little bit longer to get it than I wanted and expected, but it is a private insurance market of sorts operating for this product, I think.
Thank you, Robby, for joining us to talk about scooters and boobs I'm
a scooters and boobs guy.
Yeah, we try to really focus on the important issues here at the Reason Roundtable. Reminder that the Reason Roundtable podcast comes out every Monday, and we answer one of your questions every single week. You should check back here on YouTube for bonus questions like this one. If you would like us to answer your questions, Peter Suderman would like me to say that you should send your short, succinct, pithy, and otherwise not very long questions to podcast@reason.com. That's podcast@reason.com. Thanks for watching.